What stresses you out the most right now? Comparing health plans, checking networks, or fixing bills? Understanding how health insurance works is powerful, but using the right tools is where you start saving real time and real money. The good news? You don't have to figure this out alone. There are websites, apps, and free resources that do the heavy lifting, from comparing plans to estimating costs to fixing billing mistakes. In this module, I'll walk you through the best tools and resources that make navigating health insurance faster, easier, and less stressful. All right, for the agenda for this module, plan comparison tools, provider and network checks, cost estimators, tracking tools, free help and advocacy, bonus tools and hidden gems, pro tip roundup, real life application, closing, and next step. When you chose your last plan, did you run the numbers or just pick by premium? What would change if a calculator showed your total yearly cost up front? Plan comparison tools. When you're shopping for insurance, whether through your job, the marketplace, or Medicare, comparison tools can help you see what you'll actually pay for the year instead of guessing. HealthCare.gov or your state insurance marketplace, if you buy your own coverage, this is the official website. You can compare plans side by side, filter by premiums, deductibles, out of pocket maximums, and network size. Check whether your doctors and prescriptions are covered. See if you qualify for premium tax credits or cost sharing reductions that lower monthly or out of pocket costs. Now, here's an example. Paula, a freelancer, compared plans on HealthCare.gov. A silver plan looked cheaper at first, but then she added her prescriptions and visits. The calculator showed a gold plan will actually save her $400 for the year. Now, two, employer HR or benefit portals. If you're covered through work, don't skip your HR portal. Many large employers include cost calculators that use your past medical spending to project annual costs for each plan. Now, did you know employer calculators are often more accurate than generic web tools because they use your company's negotiated prices and payroll deductions? Instead of guessing, let data show which plan really saves you more. Before your next visit, have you confirmed both facility and clinicians are in network for your exact plan? If a directory and a receptionist disagree, what proof would you keep? Provider and network checkers. One of the easiest ways to avoid surprise bills is using your insurer's provider directory tool. It lets you confirm whether your doctor, hospital, or pharmacy is in network, meaning they've agreed to a discounted rate with your plan. Always check before scheduling. A 2-minute search can save hundreds. Here's an example. Lisa had surgery at an in network hospital, but didn't realize her anesthesiologist was out of network. That one provider added a $1,200 bill. A quick check could have prevented it. If you're unsure, call the number on your insurance card. When you talk to a representative, ask them to confirm the provider's full name and location and that they're in network for your exact plan. Insurers often have multiple networks. Then write down the rep's name, the date, and the time of the call. That documentation protects you if you're billed incorrectly later. It provides you verified coverage. Now, did you know insurer networks change throughout the year? Providers can join or leave mid year, so it's smart to confirm at least once annually. and before any major surgeries. Before every big appointment, do a 60-second network check. It's the easiest money you'll ever save. Do you know what a fair price is for your next test or visit in your zip code? How would your choices change if you saw the estimate before scheduling? Cost estimators. Ever get a bill and think, why did it cost so much? Cost estimator tools help you know before you go. One, fairhealthconsumer.org. This is a free public site that uses national claim data to show average prices in your zip code for everything from x-rays to surgeries for both insured and uninsured patients. Now, here's an example. Tom checked Fair Health Consumer before scheduling an MRI. The local average was $850. When one clinic quoted $1,600, he found another for $900. Same scan, half the price. 2. Insurer cost estimators. Most major insurers, Aetna, Blue Cross Blue Shield, Cigna, United Healthcare, include estimator tools in their apps or portals. These show personalized prices based on your plan's deductible, coinsurance, and remaining out-of-pocket balance. Here's a pro tip. If you met your deductible, the tool will display far lower expected costs. Use it when planning end-of-year procedures. Now, did you know within the same city, prices for identical procedures can vary 300% or more? Estimators reveal those differences so you can choose wisely. When you know what something should cost, you shop smarter and avoid overpaying. Could you find your deductible status and your last three explanation of benefits in under 60 seconds? Where would you store receipts so health savings accounts or flexible spending accounts reimbursements are painless? Tracking tools. Once you have insurance, tracking expenses keeps you in control. 1. Your insurance app. Most insurance apps let you review your deductible and out-of-pocket maximum progress in real time. Allows you to review recent claims and what the plan paid. Also, you can download your explanation of benefits and your detailed claim summary. Now, here's an example. Clara opened her insurance app after a hospital stay and saw that one claim still marked pending. A quick call fixed the issue before it became a billing error. Now, 2, health savings account and flexible spending account apps. If you have a health savings account or a flexible spending account, use the linked bank or benefit app to track contributions and spending, upload receipts, and reimburse yourself later. Health spending accounts reimbursement have no time limit. Here's a pro tip. Keep digital copies for every medical receipt, even small ones like glasses or bandages. They may qualify as health savings accounts / health spending account expenses. Now, did you know once your health savings accounts balance hits a set minimum, often $1,000, you can invest it? Earnings grow tax-free, making health savings accounts one of the only triple tax advantages accounts in the US. Tracking isn't just about obsessing, it's about catching mistakes and maximizing what's yours. If a claim is denied, who would you call first? Your doctor, the insurer, or a state consumer assistant office? What proof would you gather before asking for help? Free help and advocacy. You don't have to handle insurance problems alone. Free public and nonprofit resources can step in. 1. State Insurance Department. Every state regulates insurers and offers consumer assistance staff. They can help with claim denials, unfair billing, and provider disputes at no cost. Search your state department for assurance consumer assistance. Here's an example. After a $2,000 denial, George called his state insurance office. They contacted their insurer, the claim was reopened, and it was approved. 2. Nonprofit advocates. Groups such as Patient Advocate Foundation or Patient Rights Advocacy Foundation helps patients appeal denial, negotiate medical bills, and help assistance programs, all free. 3. Hospital finance assistance. If you received a large hospital bill, ask the billing office about financial assistance, charity care policies. Many nonprofit hospitals and even some for profit offered income based discounts or payment plans. Now, did you know nonprofit hospitals must provide community financial assistance to maintain tax exempt status? You just have to ask. Sometimes the biggest savings come from simply asking for help. The support systems are there, but you have to use them. Where do you overpay most? Prescriptions, procedures, or appointments? Which one tool from the next slide would you try this week to lower that cost? Bonus tools and hidden gems. Here are extra digital helpers that can help stretch your healthcare dollars. GetRx and Single Care. Compare prescription prices and print or show coupons at the pharmacy. Discounts apply with or without insurance. Bill negotiation service like Resolve Medical Bills help patients verify hospital charges and negotiate lower prices. Most work on a flat fee or contingency basis. Next, Healthcare Blue Book shows fair price ranges for common procedures in your area. ZocDoc or Solve Health lets you find in-network providers, see verified reviews, and book online appointments. Now here's an example. Sandra used GoodRx for her migraine medication quoted at $160. With the coupon, she paid $24. Same drug, same pharmacy. These modern tools take the mystery and the markup out of healthcare. Which two bookmarks will you add today so you're one step away when you need them? What alert or reminder will you set so you actually use these tools? Pro tip roundup. Quick recap. 1. Use plan comparison tools, HealthCare.gov or HR portals. 2. Double check provider networks before visits. 3. Use cost estimators for price transparency. 4. Track deductibles and health savings accounts, flexible spending account spendings. 5. Contact free advocates or state insurance department for help. 6. Book GoodRx, Fair Health Consumer, and Healthcare Blue Book. You don't have to memorize every detail. You just need to keep your go-to tools handy. The right one at the right time can save you hundreds. If you mapped out your year like the Thompsons, where would your biggest savings come from? Plan choice, network checks, appeals? What's the first step you'll copy from their playbook? Real life application. Here's what smart use of these tools look like. Meet the Thompson. Emma compared two job plans using her HR portal. Chooses the lower total year cost. She checks their family doctor on their insurance app, confirmed in network. She estimates yearly spending with the cost estimator, $2,800. She then tracks everything in the insurance app and health savings account, saving receipts. When their child needs a specialist, she calls the insurer, notes the rep's name, and confirms coverage. Later, the claim denied pops up. She contacts the state insurance office, resolved in 2 weeks. By using these tools, the family saved about $1,500 that year without cutting costs or changing doctors. That's what smart healthcare looks like. Not more effort, just better tools. Which tool will you set up right now? Insurer app, health savings account, flexible spending account app, or a price estimator bookmark? What's one routine, weekly or monthly, that will keep you in control all year? Congratulations, you reached the end of the TJ Healthcare course, Health Insurance Simplified. Save money and get the care that you need. You learn how to understand your plan and key terms, pick the right plan for your needs, save money using insider strategies, and use the best tools to stay in control year round. What's next? Well, we have a list of courses for you to help you on your healthcare journey. I'll see you in the other courses.